Hello there. My name is Gloria Uzi, and my topic for this project is phobia and anxiety disorder. Okay, so what is phobia? I explain it as it's an extreme and irrational fears of objects and situations that pose little or no danger but makes you highly anxious. So there are some things that makes people, you know, feel differently than the ordinary. Okay, so these cases, we say phobias. People with phobias critically limit their lives to avoid encountering what they fear. So, according to the American Psychiatric Association, they identify three main categories of phobias. I would say it's the social phobia, agoraphobia, and specific phobias. But in another school of thought, we have four main or four major specific, and these are the natural environment, animals, the medical treatment, and also situations. And what are the risk factors? I would say we have the negative experience, childhood shyness, genetics, learned behavior, and also exposure to stress. Further explain, there are risk factors that are characteristics related to a higher likelihood of negative outcome. They can be biological, psychological, cultural, familial, or the community level. And what causes phobia disorder? Have you considered or have you thought of or do you have in mind what causes phobia disorder? Okay, as I originally said, we have different causes, but I'm sticking to few that I wrote under here. It says we have genetics, we have dramatic experiences, environmental factors, learned response, mental health issues in family members, shyness, and classical conditioning. So these are, you know, causes of phobia disorder. And when we come to the treatment, we have the two main treatment, the non-pharmacological treatment and the pharmacological treatment. So under the non, we have, under this um, treatment, it's entails a lot of therapies. So you have the exposure therapy, connective cognitive behavior therapy, virtual reality exposure therapy, and relaxation and breathing exercises. And under the pharmacological treatment, always, practically only medications such as the antidepressant, the benzos, the beta blockers, the buspirone, and also the MAOIs. These are the major medications that I use to treat, you know, not to treat the phobia, but it's used, to treat the effect of phobias. The effect also causes the panic attacks and the anxiety. And in the patient teaching, we screen, assess, diagnose, and also that makes you know what type of treatment to give to the patient. And under the patient teaching, it involves exposure therapy and cognitive behavior therapy. And also that, in some cases the therapist will coordinate with the patient to form maybe something that will work for nursing interventions. You have to recognize the awareness of the client's phobia, familiarize yourself and also the environment that you guys are, interact with the patient calmly, avoid unnecessary assurance. All right, Thank you so much.